The Genuine Article. Discussion and commentary based on articles from JACC.
Hello, I'm Tony DeMaria, the editor of JACC, here with an issue of Inside JACC. And for this show, we're going to do something different. We're not really going to deal with a specific manuscript from JACC. We're going to talk about a topic, and that topic is translational research. And as someone recently said in an article in JAMA, there are very many differences in the definition of translational research, but everyone seems to think that it's important. And here with me to discuss this is Dr. Nabil, and Dr. Deeb is the president of the International Society for Cardiac Translational Research, and in fact that society has joined with the American College of Cardiology to really focus on advancing translational research in cardiology. So, Nabil, tell me, in the spectrum of translational research, where do you think there's the greatest hole, the greatest need for additional work?
Well, Dr. DeMaria, it's clearly the major problem right now in advancing science and taking a new concept, and new innovation to patients. As we all know, it is a very slow process and with overwhelming cost. And that's why, matter of fact, even many of the new technology and U.S. research is done outside of the United States. Not because necessarily better quality, but because things can be done. However, I think what we really should be aiming, if we want to take a concept to a patient in an expedite manner, I think we should have infrastructures that can deal with the product development, preclinical research, knowledge about the animal model, and some knowledge about the phase 1 and 2 clinical trial and where the technology is going to be applied.
So in hearing you speak, Nabil, I've really been impressed that there's a need for cardiologists to have more knowledge about the process of actually going through the regulatory hurdles to get a new technology from the discovery phase all the way to the bedside. And I think that's an area where your society particularly is going to focus. Is that correct?
And that's correct. As you know, in medical school and during our training as a resident and fellow, we never been exposed to the regulatory path. We never concentrated on the animal model and the toxicology study that are required for a new product to take it to a patient. This is a truly gap exists today, and I do believe that's why the process to take a concept to patient is slow. And because of that slow process and lack of knowledge of that structure and expertise, that leading to overwhelming costs and for the product to get to patient. So I think if we have the right infrastructure, which is we are trying to do now with the society, we have a great committee and faculty in the International Society for Cardiovascular Translational Research. They are committed to draw a path for product development, animal model, understanding the regulatory path with FDA involvement to expedite that science to the patient.
Yeah, and I think the collaboration between the ISCTR Translational Research Society and American College of Cardiology will come together and really move translational research forward. Thanks for bringing us up to date. For Inside JACC, I'm Tony DeMaria.